How would you describe medicine in the year 2040? That's right, we're going to jump ahead almost 30 years to the future. This may sound like something from Star Trek, but in a moment I'll show you that it may be a little more familiar to you than you might think. This is Dr. George Moricz with Body Hormone Balance. Oftentimes patients ask me, you know, Dr. Moricz, what will medicine and healthcare be like in the year 2030? Well, for some people, especially smart and successful people who care about themselves, well, this is what they'll be availing themselves of. Number one is they will come in and they will get their body scanned, and there'll be newer imaging technologies that will accomplish with minimal to none for radiation. Secondly, the evaluation of the body will involve body composition. As many of you are already familiar with your fifth vital sign through our in-body body composition analysis. Thirdly, blood will predict both genetically based on your type of response to everything from chemotherapy to medications to treatment protocols. In other words, no longer will one blood test seem to suggest all, or one treatment modality for common illnesses from metabolism to hormones treat everything. And many of you are already experiencing some of this individualization as you go through our Body Hormone Balance program. See, for many people who have not already experienced the individualization of your metabolism, energy, sexuality, and lastly anti-aging, this will be completely new. The arena that I'd certainly like to expose to you further is the field of anti-aging. I usually don't say much about it unless people inquire, but a lot of the steps that you're already experiencing actually encompass something called anti-aging. In other words, slowing down aging. Cells have a pre-programmed way of responding, and just like a photocopy machine, if you keep making photocopies, sometimes there's a jam, sometimes the ink does not print correctly, and sometimes things just don't work at all. If you overproduce, in other words, you made more copies of something than you needed, well, we could call that something like a tumor or cancer. In other cases, parts of the copy machine start triggering that we don't want to, and that's kind of like a light switch for a lot of our cancers. We think that there's protective genes, and when a certain light switch is flicked on, then basically you start producing abnormal molecules. So there's a lot to be said. I use cancer as an example because it's probably the ultimate in inflammation in your body. It probably overwhelms you the most. Other types of inflammatory responses will be better controlled as well in the future. Right now, many of you are enjoying what's called immunomodulation, a nice big word to say basically that hormones can be used to tune your immune response. A lot of times people come to me and they say, well, you know, I hear diabetes is early aging, early Alzheimer's, and so forth. And diabetes is a very good example. But more importantly, a lack of hormones is aging. So oftentimes I think it's been said in reverse, and maybe incorrectly. People are told that as they get older they lose hormones. No, that's why you're getting older, because you're losing the protection in your body, and that affects all your cells and your way that you mount responses. I mean, think of it, when you were 20, your immune system's a lot stronger. So as we glimpse toward the year 2040, what we're talking about in anti-aging is certainly more technology, imaging, stem cells, ability to identify a subset of approaches for an exact person. In other words, you will get more individual attention when you were treated for everything for colds, or protecting yourself against future cancers through vaccines, and intervening if you do have a problem based more individually on your family set of genetics and the way you metabolize. Now, another arena that's very exciting, and this is where hormones come in, is something called epigenetics, another large word for saying that things in our environment, everything from chemicals to plastics, any kind of chemicals are basically bombarding your body like a hormone. And this is extremely, extremely critical because as I'm evaluating hormones, there's two phenomena that you just can't deny. I have women coming in and who have extremely elevated sex hormone binding globulin, which is considered more of a hormone than it is truly just a transporter molecule. And what that's indicating is the environment itself is influencing the way that your genes produce proteins. So that's called epigenetics. In men, since the 1950s, we've seen a nosedive in both testosterone, male hormone levels, and sperm counts, fertility. That's why we're seeing men go into andropause or the male menopause a lot sooner. And the infertility rates are much higher than they were years ago in young and middle-aged men. So these are just some small examples. As we tread through anti-aging, I will be sharing more and more with you. You'll hear a lot about me from hormones. I have not even scratched the surface. At Body Hormone Balance, we are steadily launching new programs, and sometimes I pre-launch a program if I'm forced to take care of something that a patient could really benefit from. And you'll often see this in the nutritional arena. I have several programs, everything from a GI detox program to fine-tuning some of your nutritional deficiencies. Of course, this implies that you're interested in anti-aging, and certainly someone felt that aging was inevitable. I would never try to talk them out of that. On the other hand, there are many nutritional modalities that can influence the way your cells are, protect your cells, help your energy levels, and in the future modulate inflammation as well. So as you look at our anti-aging programs, we're doing neurochemical testing. I'm doing intracellular testing for nutrition, something you've probably never even thought of, but actually it was a technology that came out of the University of Texas, was sold to the commercial sector, and so basically I'm able to tell you what your cells have been doing nutritionally for the last 6 months. In other words, not just your blood levels, but inside your cells. And these technologies allow me in a very short 6 months to correct all your nutritional deficiencies. Just for kicks, I'll even show you my intracellular analysis the next time you come in for screening. Ask them, and I'll actually show you my own. I know doctors aren't supposed to talk a lot about themselves, but I'll show you my antioxidant levels and see how I attack them and change them around in a few short months. And this is exciting information that everyone needs to know. Anyway, a lot to talk about. Keep your eyes and ears open to anti-aging. For any referrer friends that you have, we have a new anti-aging kit which introduces a lot of things you're already familiar with our metabolism, with our energy protocols, our hormonal optimization as part of our anti-aging movement in the future. Thank you.